Do you really need a statin? LDL cholesterol, heart disease risk, and prevention explained today. Your LDL cholesterol is high, but does that automatically mean you need a statin? What if your LDL is 160 but you feel perfectly healthy? And why are some people with normal cholesterol still having heart attacks? Today, I will explain how doctors actually decide who benefits from statins and who doesn't. Hi, I'm Dr. Kuldeep Singh. On this channel, we break down medical topics so you can make smarter, calmer health decisions. Quick disclaimer before we begin. This video is for educational purposes only. It does not replace personalized medical advice. Always talk to your own doctor before starting or stopping any medication. Heart disease is still the number one cause of death worldwide. LDL cholesterol plays a major role, but cholesterol numbers alone don't tell the whole story. The real issue is risk, not just cholesterol. So, what is LDL cholesterol? LDL stands for low density lipoprotein. Think of it like a delivery truck carrying cholesterol through your bloodstream. Over time, too many LDL particles increase plaque buildup in the arteries, leading to heart attacks and strokes. But here's the key: LDL causes damage slowly, over years and decades. Today, we are talking about primary prevention, preventing the first heart attack or stroke. This is very different from secondary prevention, where disease already exists. How doctors actually decide. We estimate your 10-year ASCVD risk, which includes age and sex, blood pressure, LDN HDL, smoking, diabetes, and family history of heart attack. Statins reduce relative risk by about 30%, but the absolute benefit depends on how high your risk is to begin with. So let's talk about who definitely needs a statin. LDL over 190 milligram per deciliter. If your LDL is 190 or higher, treatment is clear. We don't even need a risk calculator. This often suggests genetic cholesterol disorder, and early treatment save lives. High and very high risk patients. So if your 10-year risk score is above 7.5%, statins significantly reduce heart attack and stroke risk. So at very high risk, above 20%, we often use stronger treatments. The gray zone. Here is where many people live, the intermediate risk zone. Here, shared decision making matters. Factors that push us towards treatment include LDL over 160, family history of early heart disease, kidney disease or chronic inflammation, high inflammatory markers such as HSCRP. There is a recent article about ACC, which is American College of Cardiology, recognizing high HSCRP, an important marker for cardiovascular risk. Uh, Also, sometimes we use coronary calcium scans to help decide. So I'm often asked, can diet and exercise fix this? Lifestyle is essential. Mediterranean diet, exercise, weight loss. But here's the honest truth: lifestyle lowers LDL by 10 to 15% only, where statins reduce the LDL by 30 to 60%. So for high risk patients, lifestyle alone usually isn't enough. I'm often asked by my patients, what if I can't tolerate statins. So, statin side effects are real but manageable. And nowadays, we also have excellent alternatives such as ezetimibe, bompedoic acid, and recently there have been more advancement in the cholesterol treatments, such as PCSK9 medications, injectable ones. Recent trial shows that these also reduce cardiovascular events. So, quick myth busting about the cholesterol and statins. Let's clear up some common fears. Muscle pain, uh, sometime it can happen, but it's usually reversible. And some people who cannot tolerate due to muscle pain, we look for some alternatives. Um, we often give them a lower intensity statin or non-statin drugs. Uh, then diabetes, there is a small risk of increase in the blood glucose by the statins, which is outweighed by the benefits. Next, I'm often asked is memory loss. So it has not been supported by the evidence that statins do cause any permanent memory loss or Alzheimer, as contrary to what we hear on the social media. Sometimes a temporary mental fogginess can happen, and that usually goes away after stopping the medication. So, final takeaway, the question is not, is my cholesterol high? The real question is, what is my cardiovascular risk and how much can I reduce it? If this helped you, like, subscribe, and share this with someone confused about cholesterol. Drop your questions in the comments. I read them. I'm Dr. Kuldeep Singh. Thank you for watching.